My specialty is pain management. And what I see is the difference between a child in such severe pain at the end of their life that their parent cannot even hold them because it's too painful, to getting their pain control back and seeing them sit at their bed in the hospital playing with their cereal, pointing a spoon at their grandmother saying, "Go make me cookies." That's pain management, and that's what I do.
It is always important to treat pain. It really affects your life, your functioning, and your health.
It can take some effort and energy, but when you work with individuals and work through their plan individually with them to see them get better and regain a lot of their life, it's very rewarding.
I think one of the key things I can do as a nurse is to offer people hope, no matter where they're at. If they're brand new in their experience of pain, I can sit with them and hold their hand and let them know that there is hope in sight, there is help coming, there can be relief.
We understand that pain is very complex. People in chronic pain will most likely always have some element of pain. What we want to do is improve quality of life through a multitude of things.
I have the great privilege to get very, very close to patients, to really look at how a chronic illness such as pain impacts their lives, and then to be able to work with them and really to find ways that they can cope with this, a true chronic illness, and to be able to make their lives better.
We're not always going to make them pain-free, but as long as we can make them as comfortable as possible, we do anything we can, whether it be physical, by giving them medications, by giving them physical therapy, by just talking with them and sitting with them and just being present with them.
Chronic pain is something that will never go away, is something that needs to be addressed. You need to address what is causing the pain, and the sooner you do that, the better the outcomes are going to be for the patient that is having pain.
Every person deserves good pain management, that we are here to help with pain management, and nurses can go a long way in assisting other healthcare providers to give people adequate and proper pain management.
One of the things that I tell nurses and that I try to practice every day is that if you're with the patient and you show that you care about the patient, you give that person hope so that they can see that there may be some relief. We can always do something to offer relief to our patients.
The role of the nurse is to be the caring advocate for the patient and to make sure that the needs of the patient are conveyed to the doctor.
If they can get up and do the things that they didn't used to be able to do, if they can take care of their kids, go back to work, anything I can do to improve their quality of life is what I'm out for.
Seeing someone who was really struggling with pain, whose life had become really marginalized, not working, not being able to get up, not being able to prepare dinner for families, and then seeing the pain improve to the point where those simple things that most of us don't think about were able to be done more comfortably.
People get better, and I think that that's really the rewarding part of it.
As a nurse, I've had patients, and I can think of one patient in particular, who had arthritis, and she wasn't able to do her job as a physical trainer because of the pain, but after we got her on treatment with some powerful pain medicines, she was able to exercise again.
Soon she was able to be back doing what kids do, which is go to school and have fun, and her family was able to get their life back as well and really enjoy their daughter.
After our treatment, everything improved. Her sleep was better. She was able to be more a part of her children's lives. She was able to return to her job.
That was probably one of the greatest days. She just bounced into clinic and said, "I'm done with you guys." She was very thankful because she was able to be back with her friends and back in school and really did well.
I think the single best part of being a pain management nurse is seeing the difference you make in children's lives, in my case. To see a child who can go from not being able to being held, to being loved, to being rocked, read to, have any joy, no giggling, suddenly to a child who returns to themselves and can have all of those things. and starts to giggle and laugh, and their last days are ones that are as good as any possibly could be. That is the greatest gift we can give any child ever.
I would tell them to not be ashamed, not be afraid, to ask for help, to find pain specialists, to go in and talk about pain, because there are things we can do to help you with the pain.
So I tell patients all the time, if you don't tell me, I can't help you. So the more that they talk with their healthcare providers about it and really look for other things to do to make themselves better, they have much more possibility of a quality of life.
There are many, many treatments that are available for patients with chronic pain.
If a patient's being told that we don't do this here, or I don't think there's anything that I can do for you, what the person is saying is, we can't help you, and the patient should say, I think I'll go somewhere else.
We're going to start looking at you with fresh eyes. We're going to say, okay, maybe you did have an injection 20 years ago. You know how much better we are now that in our 20 years later? And we always give that patient hope that there's a pair of fresh eyes going to help them have a fresh start.
You do not need to suffer in silence, that there are pain management practitioners out there that are really willing to work with patients in many, many ways to really help to increase their comfort level and their quality of life.
My recommendation to people who are suffering in pain and to their families is to come forward, seek the advice of experts in pain management. The science really has moved forward. We are beginning to understand more and more about pain, and there are things that we can do. And we will stick with you. We will do what it takes. We're not going to do one treatment and abandon you. We are there for you, and we're going to stand by you.